thank you for your interest in the Mammo-50 trial. Mammo-50 is looking at mammographic surveillance in early breast cancer patients aged 50 years or over at diagnosis, and it's designed as a non-inferiority trial of annual mammograms versus less frequent. The background to the trial was that in the USA and Europe there's guidelines that exist recommending annual mammograms for ladies undergoing the treatment of after the treatment of breast cancer, but there's no specific time to stop these. In the UK our guidelines recommend annual mammograms for 5 years, and then we can follow patients up through the screening system. So our breast cancer screening is every 3 years. So the aim of Mammo-50 was to see whether less frequent mammograms was non-inferior to annual mammograms, and that's what we found in the study. So we found no difference. Having recruited 5,235 patients, we found no difference between the two study arms in terms of overall survival, breast cancer specific survival, relapse-free interval, and then we also looked at quality of life. We had 4 quality of life scales measured, and we had patient booklets collected annually, and there was no difference across any of the treatment arms across any of the quality of life scales. What we did find though was at baseline pre-randomisation, using the distress thermometer, we did identify 6% of ladies who actually presented with high levels of distress. And what we did within the study is to monitor that level of distress and to feed back the reasons why patients were presenting with that distress. And it was a lot of it was related to hormone therapy in terms of hot flushes, worry, fear and anxiety. So we fed that back to the clinical team, and that was very helpful in the management of those patients. So we would recommend, so the conclusions from the Mammo-50 trial is we would recommend changing guidance, because we've shown that less frequent mammograms are non-inferior to or safe, no worse than annual mammograms. So certainly within the UK we're looking at changing guidelines.